Uh, in your experience, or rather we all have seen that in this pandemic, the lower strata of the society has paid the price of security of the privileged sections. So what is in your experience the effects of this pandemic over the different classes of the population?
Yes, exactly. This is a very good question. In fact, there was an article, I think, in Lancet, or it's a viewpoint in Lancet, or I think in BMJ. The first year of the pandemic, the author says that the restrictive measures like lockdown and other things are the price which the poor pay in poor countries to save the rich in developed countries. So similarly, inside India also, we are a very large country. We have got diverse socioeconomic strata. We have the richest of people. We have the poorest of people. And the brunt was borne by the poor people in a manner which did not help them. They were never at risk because most of the poor people, they are young. They do not live to very age like 80s and 90s, which are the actual vulnerable people for COVID. So they are young people, and even if they live to 80 to 90, the poorer strata, they have got immunity because they have been exposed. The immune systems are very good. They are exposed to so many infections, and the very fact they have survived, nothing happens to them, even with a minor coronavirus infection. And secondly, these restrictions, this lockdown, were blindly applied from the West, whereas all social conditions are different. That is, we neglected the social epidemiology. We have got a 10 times, 20 times more population density than the European countries. And we have got in a slum or in a tenement, in one room, 10, 12 people stay. And if they are working throughout the day, they are dispersed. If their lockdown is there 24 hours, they are more crowded, more dense. In fact, the infection will spread faster. And that's exactly what happened. In the first wave only, they got the herd immunity. Upper class were left vulnerable, and it did not help them. Unfortunately, some misinterpretation of data, like outdoor transmission is negligible. Most of our poor people are in the unorganized sector. They are selling something they are vendors in the thela. They are selling their fruits. They are working outdoors. There is no transmission outdoors. And by lockdown, they have been brought indoors, just the opposite of what you are